Prostate cancer is a type of cancer that affects millions of men all over the world. It takes place in a man's prostate, which is a small gland located below the bladder. Prostate cancer happens when the body cannot control the growth of abnormal prostate cells. Testosterone is a hormone, sometimes called an androgen. It is produced in a man's testicles and travels to the prostate. Inside prostate cancer cells, testosterone attaches to special proteins called androgen receptors. When this happens, it can trigger processes that cause prostate cancer cells to grow. If you have prostate cancer, you may have been treated or are currently being treated with ADT, which refers to a medical or surgical treatment that lowers testosterone. Sometimes, prostate cancer can stop responding to ADT. This means cancer grows even when your testosterone levels are low. If prostate cancer is contained within the prostate, it is non-metastatic. Prostate cancer can become metastatic. This means that it spreads outside the prostate to other parts of the body. For some types of prostate cancer, there is NUBEQA, darolutamide. NUBEQA is a prescription medicine approved to treat adults with prostate cancer that is not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone. This is known as non-metastatic castration-resistant prostate cancer, or NMCRPC. NUBEQA is also approved to treat adults with prostate cancer that has spread to other parts of the body and responds to a medical or surgical treatment that lowers testosterone, with or without docetaxel. This is known as metastatic castration-sensitive prostate cancer, or MCSPC. If you are being treated for non-metastatic castration-resistant prostate cancer with NUBEQA, or for metastatic castration-sensitive prostate cancer with NUBEQA with or without docetaxel, you may still need to undergo or continue ADT, which refers to a medical or surgical treatment that lowers testosterone. NUBEQA is a pill. So how does NUBEQA work? NUBEQA is a type of medicine called an androgen receptor blocker. This means that NUBEQA attaches to androgen receptors inside prostate cancer cells. When this happens, it blocks testosterone from attaching to the androgen receptors, preventing it from going to the control center of the prostate cancer cell, stopping the signals that tell prostate cancer cells to grow and spread. Whether you have non-metastatic castration-resistant prostate cancer or metastatic castration-sensitive prostate cancer, your doctor may consider using NUBEQA. What is NUBEQA? NUBEQA, darolutamide, is a prescription medicine used to treat adults with prostate cancer that is not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone. That is spread to other parts of the body and responds to a medical or surgical treatment that lowers testosterone. That is spread to other parts of the body and responds to a medical or surgical treatment that lowers testosterone in combination with docetaxel. It is not known if NUBEQA is safe and effective in females or children. Important safety information. Before taking NUBEQA, tell your healthcare provider about all your medical conditions, including if you have heart problems, high blood pressure, diabetes, or high amounts of fat or cholesterol in your blood, dyslipidemia, have a history of seizures, brain injury, stroke, or brain tumors, have kidney or liver problems, are pregnant or plan to become pregnant. NUBEQA can cause harm to your unborn baby and loss of pregnancy, miscarriage. Have a partner who may become pregnant. Males who have female partners who may become pregnant should use effective birth control, contraception, during treatment and for 1 week after the last dose of NUBEQA. Talk with your healthcare provider about birth control methods. Are breastfeeding or plan to breastfeed. It is not known if NUBEQA passes into breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. NUBEQA may affect the way other medicines work, and other medicines may affect how NUBEQA works. You should not start or stop any medicine before you talk with the healthcare provider that prescribed NUBEQA. Know the medicines you take. Keep a list of them with you to show to your healthcare provider and pharmacist when you get a new medicine. NUBEQA may cause serious side effects, including heart disease. Blockage of the arteries in the heart, ischemic heart disease that can lead to death, has happened in some people during treatment with NUBEQA. Your healthcare provider will monitor you for signs and symptoms of heart problems during your treatment with NUBEQA. Call your healthcare provider or get medical help right away if you get chest pain or discomfort at rest or with activity, or shortness of breath during your treatment with NUBEQA. Seizure. Treatment with NUBEQA may increase your risk of having a seizure. You should avoid activities where a sudden loss of consciousness could cause serious harm to yourself or others. Tell your healthcare provider right away if you have loss of consciousness or seizure during treatment with NUBEQA. The most common side effects of NUBEQA include increase in liver function tests, decreased white blood cells, neutropenia, feeling more tired than usual. The most common side effects of NUBEQA in combination with docetaxel include constipation, rash, decreased appetite, bleeding, weight gain, high blood pressure, decreased red blood cells, anemia, high blood sugar levels, decreased white blood cells, increase in liver function tests, low blood calcium levels. NUBEQA may cause fertility problems in males, which may affect the ability to father children. Talk to your healthcare provider if you have concerns about fertility. These are not all the possible side effects of NUBEQA. Call your healthcare provider for medical advice about side effects. You are encouraged to report side effects or quality complaints of products to the FDA by visiting www.fda.gov/medwatch or calling 1-800-FDA-1088. Please see full prescribing information at www.nubeqa.com/PI.